you. I'm Jess Barron. I'm the GM of Livestrong. It's a healthy living site with 27 million Americans visit each month. And I'm here to talk about how the quantified self movement is reshaping healthcare and self-care. So let's dive in. So as a person running my business at Livestrong.com, there are a number of metrics that I need to pay attention to. For example, we have users that are looking at and tracking their food on our calorie tracker, trying to lose weight. So I look at how many foods they're tracking, and that was 400 million foods that were tracked last year. And then they burned 850 million calories that they tracked on our MyPlate calorie tracker app. And that, over the course of the year, caused them to lose altogether 20 million pounds. So I'm looking at metrics like that, and then I'm also looking at metrics and data from independent outside reporting, such as ComScore. So they tell us, we had 26 million unique users in the US last month, 68% of them are women. I also look at, where do we stand in comparison to our competitors? So we are #1 in healthy living, #1 in fitness, and #4 in the health medical space behind WebMD, Everyday Health, and Health Grades. So it's important to keep track of where we stand in the leaderboards. Other metrics that I'm looking at are emails. So I'll check to see, the health of our email list, 4 million subscribers, how are they opening? About 24% are opening. And so those are some of the metrics that I take a look at to run the business. But I'm a human being, and so are you. And so what kind of metrics do we look at to make sure that we're running our bodies and ourselves and our organizations well? So the first thing I would look at, maybe I check my jawbone when I woke up this morning and see how much sleep did I get last night. So I got 7 hours, 7 minutes. That's probably about as good as it gets, so pretty lucky, even though went out a little bit on Broadway last night to some of the clubs over there. And got some good amount of REM sleep, actually, about 1 hour and 24 minutes, so that's not too bad. And then I used my Livestrong calorie tracker, MyPlate, opened that up to see tracking my food, which was kind of crazy today in Nashville, and I kind of overdid it, so I was just looking and to see how many calories I have left for dinner. I don't know if I'm gonna be able to fit it in on my calorie budget tonight because it says I have only about 380 calories left, and I've only eaten, the most interesting part of all of this one is looking at how much protein I've eaten. It's only been 20 grams for the day, and so the average American sedentary woman needs to really eat about 50 to 75 grams of protein a day and more if she's active. And the reason for this is if you can keep your protein at 25 to 30% of your daily caloric percentage of what you eat versus carbs and fats, you will burn actually about 100 more calories a day just by eating that protein because it's more difficult for your body to digest. So I'm looking at that and thinking, well, I probably have to eat something pretty high protein tonight, and that's what I'm going to aim to do. And then looking at the Fitbit, looking at how many steps did I take yesterday. So I didn't do too badly. I got about 13,000 steps, and a lot of that was airport stepping, walking around Nashville, and then of course, the conference is rather large too, so I'm probably doing all right today on that. And then someone earlier, I think it was Sean, was talking about how, some of these devices, people are wearing them, but it's not motivating them. And I'm actually going to be taking the opposite viewpoint on that today because we have a lot of data with my site and the apps that I work on, as well as I've looked at data from other wearables such as Fitbit, Jawbone, and others, and they are actually getting quite a bit of success. And the reason for a lot of that is when you look at the leaderboard and you have a group of friends or people that are colleagues or whomever that is your support system and that you're competing against. So I look at my leaderboard pretty much daily, and I have a bunch of friends that I'm competing for, usually first, second, or third place against, and they're all a bunch of 40-something tech workers who are fighting against dad bod and muffin tops, and they're trying to just stay fit as they can be. And so every day I look to see where am I at? Am I going to meet my steps? Am I going to beat my friend Michael Spiegelman? We'll see. That day it looks like yesterday he beat me, but often I'm trying to get a few more steps, take the dog for another walk, go out around the block, or even sometimes when I get home from work, I check the leaderboard or where I'm at with my steps, and it's after dinner, it's maybe 7:30, 8 o'clock. All I want to do is sit down and watch some TV and kind of zone out. But if I'm close to meeting my steps, or if I'm close to beating somebody, or even pretty far behind, the next thing I'm going to do is try to get those steps. And there's goofy things that everybody does. There's a lot of, you can look online, like different ways to get your steps on Fitbit. People are sitting there running in their living room, kind of moving their arms, and it seems goofy and it seems like a cheat, but the funny thing is these also have heart rate monitors inside them, and it will get your heart rate up. And so it is silly, but it's something that helps people to inspire them, to get them to reach their goals. And it really does feel so good when these things vibrate and they tell you you got your 10,000 steps for the day. It's like a little reward. So why are we trying to reach this magical 10,000 steps anyway? So this is a question. A lot of my website, people come to because they're looking for answers to questions. And one of the most popular questions last year was, what is so magical about the 10,000 steps? Well, I am here to tell you, and it all starts with Dr. Yoshiro Hatano, who is a Japanese doctor. In the early 1960s, he was concerned because he felt that, even though Japan really led the world in healthy eating and exercise and longevity, that after the war, they were starting to import a lot of things from America that were maybe making them a little bit less healthy in the food and sedentary behavior. So he looked at what were people doing for activity every day and what was the average. And it looked like people were averaging about 3,500 to 5,000 steps a day. And he theorized, well, if I could get people to add an additional 5,000 steps every day, they could burn somewhere between 200 to 500 calories extra, which depending on your gender and their height and weight. And that could actually get them to lose about a pound a week or something along those lines. And so that was kind of his theory, and he started to kind of get that out there. And now, this theory wouldn't have necessarily stuck if it weren't for these two things that really helped to propel it. So the first one of those is the 1964 Olympics, and those were held in Tokyo that year. And that was the first Olympics that was ever held in Asia, and also the first Olympics that was broadcast via satellite and in color as well in Japan. And so people were getting very into fitness and the idea of athleticism. It was really something that was just in the zeitgeist at that moment. And then the second thing that really helped the 10,000 step idea to stick is the manpoke. And this is the 10,000 step meter. So man stands for 10,000, po is step, and k is gauge or meter. And it was a little device, a pedometer, that was invented by a Japanese watchmaker in 1965. And they went out with the magical marketing tagline, "Let's all get 10,000 steps." And that idea actually really resonated for them because in Japan, 10,000 is an auspicious number. And so it worked really well. And you can see in that picture there are people, walking clubs all throughout Japan kind of took this idea unto themselves and started, keep walking to get 10,000 steps a day. So that is kind of why we're all aiming for the 10,000 steps. It's really nothing magical. But in a way, it is something magical. So when you look at, in Japan, pedometers, even before Fitbits and Jawbones and all that, pedometers were still something that you would find in, the average Japanese household. And you can see that they have the world's highest life expectancy. And they are at 84 years, that's their average life expectancy. And where does the US rank? The US is 34th on the life expectancy at birth list as of 2014. And so walking is a great thing, and there are more than 30 proven health benefits. A lot of things that people are taking medicine for today, whether it's to help them to sleep better, decreasing knee pain, lowering blood glucose level, decreasing your body weight, and engaging in toning your muscles, and improving your memory and your mood, which are a lot of things that people take medications for. And it's free and it's fairly easy. So how is the US competing on its leaderboard against some of its international friends? Well, when you look at the US, we're getting just about between 4,000 and 5,000 steps a day on average. In the UK, they're doing slightly better than us. They're getting just a little bit over 6,000. Japan is more in the mid to high 7,000 to 8,000 range. And then Switzerland is that one up at the top, and they are just at about 10,000 steps a day on average. So then you look at, and I don't need to tell you guys this, but where does the US compare to the rest of the world in obesity rates? Well, we are number one, definitely the highest. And then if you look down there at the bottom of the list, you'll see Japan and Switzerland. And the UK, who's taking step levels similar to ours, they're not too far behind us, actually. They're at the top of this leaderboard. And then you guys know this too, how do we compare against the rest of the world in healthcare spending? We are number one again, and it's the highest right there, spending 16% of our GDP on healthcare. And you can see some of those other countries are far lower on the list. So in 2018, we're expected to spend $344 billion on obesity-related healthcare costs in the US. So that's growing quite a bit. And when you look at how it raises the risk of serious health conditions, which a bunch of people have talked about earlier today as well, diabetes, cardiovascular problems, dementia, some cancers, it is definitely something that is preventable and something that we could try to have a handle on some more of this. And the more pounds on people have been shown to cost more money when it comes to emergency room costs, doctors' costs. The more pounds on each person, the more that cost generally will go up. And then you might think about, well, is this really something that we can control? When you look at the factors that shape a person's health, 50% of those are healthy behavior. And the rest is 20% environment, 20% genetics, and then 10% access to care. So imagine that 50% of what shapes any of our health, all of our health, is stuff that's within our control. And that's something that's really important to keep in mind, and for doctors and patients and people in this industry who are entrepreneurs to keep in mind, because it means that we have a lot of opportunity for how we can shape this and make things a lot better than they are. So this whole quantified self thing, it's been probably for the last, 5 or 6 years. It's not new, but it is exploding now because of the inexpensiveness. But when you think about journaling how much food you eat, and someone earlier talked about Weight Watchers, you can just write down, here are all the things I ate and here are how many calories they are in a notebook. It's pretty much free. It's fairly easy, but it's time consuming and cumbersome too, and a lot of people fall off the wagon just after a few days of trying it, but it helps them to see how much they're eating. Whereas now, you can take an app like, the woman there in the picture has, like our Livestrong MyPlate. You just, if you have a barcode on something you're eating, you snap the picture of it and it immediately tracks that food. It's a lot easier for people to follow and to stick with. And then when you think about the pedometer, the Manpoke that I talked about earlier from Japan was by no means the first pedometer. That sketch on the other side that you see there is Leonardo da Vinci's first pedometer that he drew to help track Roman soldiers and how many steps they took. And so that was really the precursor for what we have today in these fitness devices, wearables that are connected to apps that help us to track the data. So like, if you go running or walking, there's no need to enter anything or even know how much time you worked out. Your Fitbit is gonna tell you, or your Jawbone, about how far you've gone, approximately how many calories you've burned and all that. You don't really need to do anything to make that happen. And so, as you guys all know, it's a $700 million industry. It's growing incredibly quickly. Fitbit's dominating. Jawbone and Nike and some others also have a cut of what's going on in the industry, like the Misfit Shine that's pictured there as well. So it's really something that's exploding right now as of the last couple of years. And how it works, which is really interesting, it's not just, and I think Sean alluded to this earlier, you don't just snap on a Fitbit or a Jawbone and expect people to get better, to improve how they're doing. It's really about creating the feedback loop. And for apps and gadgets to work, they have to do this. It has to work this way, where the user is going to take an action, and then that action creates data, and the data goes to a database. But then the most important aspect on that feedback loop is in blue at the end in the aqua, where it says feedback. The feedback has to be given to the user in a way on a dashboard that makes sense to them, that shows them, well, if you do this, you're doing this, and this is what the outcome of that is going to be. And that may inspire them then again to take an activity again that is going to be either better or worse than the previous, or the same. But usually it does inspire them to change their behavior, and that's exactly why not just putting one of these on your wrist is going to help you, but it's looking at your dashboard every day and seeing, how am I doing? And what's really cool about Jawbone is that they coach you. So they'll actually say things like, when you wake up in the morning, your heart rate was a bit higher last night. So for mine, it said that, because it said, you might be a bit dehydrated. Or like maybe it also doesn't ever say, you probably had a few too many drinks out there last night. But that's basically what it's implying. I'm like, oh my gosh, is it telling me something? But it does it in a very helpful way, where it's like, make sure you drink more water today, don't do that again tomorrow. So it's great because it does inspire that feedback loop. And here's another look at how the feedback loop works. So the first 4 on this list, going from orange to the aqua, perceive, feel, evaluate, and act. That's what we're all doing all the time. But the last 2 are the things that are added onto your feedback loop when you add a wearable device, or if you add it to a patient or somebody at a workplace. They track and they get feedback, and then they'll perceive again, feel, and it definitely has some kind of an impact on the way that people behave, and I'll show you a little bit more about that. So previously, in the past, it was just you would get your metrics and your data about how your body was doing. We all know by going to the doctor, getting blood pressure taken, getting our temperature taken, finding out about our cholesterol, and you really didn't find out about something usually until there was a problem. And that's very reactive. That's a very reactive system. And what we're doing now is enabling everybody, all of us, to be more proactive, to really take account what is going on. You can take your own blood pressure with that monitor cuff that's pictured there. You can actually have apps telling you when it's time. There's blood glucose monitoring, which I'll show you a little bit about as well. And it's allowing us all to be more in charge of what's going on and take a better, more proactive stance and really being responsible for our own health and self-care. So does it work? So let's meet Chris Dancy. He calls himself the most quantified man. He, back a few years ago, was an out-of-work IT support manager, and he started, all of a sudden, got a Fitbit, and then got a Jawbone, and then got a Body Media Fit, Google Glass, a Lumo posture monitor, and he started to wear more than something like 50 different monitors all at once, and he called himself the most quantified man. And so what did this do for him? It's kind of interesting. He actually ended up, all of this monitoring helped Chris to transform his life. He ended up losing over 100 pounds. And he did it primarily at first not by dieting, but by looking at the different kinds of things in his life that made him either eat more some days or be less active or be more stressed because his heart rate was up. And it was things like eating in restaurants with bright lights, or sometimes was one of the triggers for him, or being around certain people who caused him to eat more. So he started to change different habits related around areas where he saw things that might stress him out and cause him to eat worse or to exercise less. And now he has a lot of alerts. His posture meter tells him when he's been still for too long, so he gets up and walks. He also, he won't look at text messages or read emails unless he's walking to read them on his phone. So he has a lot of little things that he's done to change his life. But we don't need to be the most quantified man in order to have results. So there's also other people. So this is one of our Livestrong users, and we have hundreds of success stories that have shown how people look at our app and use our app, and it helps them to get success. He's a dad, and he actually had survived testicular cancer and ended up bloating up to about 260 pounds, gaining a lot of weight. And he realized that he was getting really unhealthy, started using our app, tracking what he ate, tracking his exercise, and has lost 70 pounds. And so it's one of those things where now he's a half marathoner, a marathoner, and he's lifting weights to build muscle at this point. He's not the only one, and now we're going to hear from Kate, who is a 30-year-old woman who lost over 100 pounds using Livestrong.
Before joining Livestrong.com, life was pretty tough for me. I weighed, it was over 270 pounds. You just have to push yourself out of that comfort zone and realize that there's so much fun and so many great things on the other side of fear.
Spinning backhand!
The Livestrong Calorie Tracker app was awesome when I finally made that decision. They already had a lot of the food plugged in there, so I didn't have to do all this research. Just being able to have that community to turn to and talk to other people who have been kind of in my shoes and experienced what I've experienced has been huge. Now, not only am I training for fights, I get to coach. I am running 5Ks, half marathons, obstacle races. Life is amazing. If you had told me 5 years ago that I was going to be an MMA fighter, I would have looked at you and just started dying laughing.
So Kate's really interesting because she was someone who was bullied for a long time in her teens and early 20s from being overweight. And then she ended up not only losing that weight, but then deciding to become an MMA fighter. So it's all about what people do beyond that. It's not just dieting to be small. It's being able to be fit to live a life that's exciting and healthy and vibrant. And as you guys all know, obesity is a huge epidemic in the United States right now. They say 3 out of 4 American men are overweight, and it's just been exploding since the 1960s. And if you've probably seen this map as well, it's pretty interesting how things cluster and what you can learn about that. So when you look at Arkansas, Louisiana, Mississippi, West Virginia, those are some of the states that right now in the US have the worst obesity. Colorado is actually the most healthiest and has been for about, I think it's the 15th year running. It's also #1 in physical activity, and it's #2 lowest in diabetes prevalence. So there is something to be said for the activity event, and inspiring that can help people to lower obesity rates. And why are Americans gaining so much weight? It's really not rocket science. When you look at 1970 compared to 2010, Americans were eating 450 to 600 more calories a day, and that's something like one extra sausage egg McMuffin or an extra Philly cheesesteak. And then, of course, activity levels at our jobs have decreased by 100 calories a day. Jobs were a lot more active in 1960 versus in 2010, when everybody's a lot more sedentary, working on computers and sitting at their desks. This is NICKY Hollender. He's one of our livestrong.com trainers, and he trains a lot of uber successful celebrities and businessmen how to run their bodies like businesses. So he's working there with Gordon Ramsay, who's a chef and restaurateur, as well as Graham McTavish, who's in the Hobbit movies. And he says he told me whenever he gets with a new client, he asks that person, you know, hey, do you know what your metrics are? Like, what's your intake of calories versus like, what you're burning every day? And they always pretty much shrug their shoulders and tell him that they have no idea. And he's like, wait a second, you run a very successful business. Would you ever run your business without knowing your metrics and what those are and how are you having an impact on them? And they say no, and then he usually gets them to start paying attention to those things. But there are a lot of people out there who are not paying attention, and they usually won't really know what's happening until something goes wrong. So this is why Quantified Self is providing the power to improve our self-care as well as our health care. And getting social support, sharing that info with doctors is really important right now. That's one area where things do need to be improved. There was a survey of, I think it was 3,000 doctors. They found that only at least 88 to 90% of them had never had anyone that had a Fitbit or a monitor gadget share that information with their doctor to try to see how they could improve their health or what they could be concerned about. So that's definitely an area where we need to improve the connectivity between the data that's collected by these with our doctors. And it really does help people with goal setting, progress, and motivation. And then here, this is actually a very interesting one. In 2015, it was an interesting year because for the first time ever, this is the Dexcom glucose monitoring system. They allowed their data to be put into the cloud and shared via iPhone so that caregivers and parents, in the case of kids, as well as spouses, could know what's going on with someone's glucose monitoring in the case of diabetes, to know if an issue was coming up. So it really does improve monitoring, and that's just starting to happen now. Obviously, could disrupt the insurance industry, these wearable devices. People are wearing them. Companies are getting people to wear these for getting different kinds of benefits, lowered premiums if you're taking more steps. Also, there's like a carrot versus stick approach. You could also get higher premiums if you're not becoming active or eating right or quitting smoking. So that's something to keep in mind as well. And it's something to keep in mind because not only are our employee premiums high, but everybody's employer premiums are as well. So I'm about to run out of time, but I wanted to just tell you guys that, yeah, Quantified Self is really helping. And it's not something that's just a flash in the pan, but it's something that we all need to work together to do more with. And we will. Thank you, guys.